Uganda's Health Ministry, through Uganda Virus Research Institute Uvri, has said its readiness to sip samples from the notifiable cases of plague invasion in the Eastern Democratic Republic of Congo. In a 3-day cross-border engagement organized by Uganda Virus Research Institute in partnership with Center for Disease Control, aimed at strengthening cross-border surveillance and response to plague, Tom Lutalo, an assistant director at Uvri, confirms that Uganda's laboratories have large capacities to serve the East African member states, since they have been used as reference labs by several countries to do their confirmatory tests.
And that's why when these discussions that have been happening, you've heard of CDC presentation when they have surveillance zones. Surveillance zones are going to be promoted in such a way that there are zones in the DRC, there are zones in Uganda, and there's going to be systems used to ship samples to the laboratory. Okay? Yeah. But now it has to be open to even our DRC region.
Although Uganda last recorded a plague case in March 2019, the country is now focusing on ensuring that her neighbors in a risky situation are bailed out of the epidemics. Adiroli Ntatiku, the programs manager at Uganda Virus Research Institute Arua branch, noted that the regional laboratory has enough capacity to run samples from both neighboring countries and those within Uganda.
The plague laboratory actually has the capacity to test samples that can even come from other neighboring countries, because it has been upgraded, and one of the reasons that it was upgraded is the fact that it is strategically located to serve both the DRC and then Southern Sudan. We can even handle more than the 100 cases, because Uvri is big and we have enough laboratory capacity to handle any amount of cases that can come, especially relating to plague.
Records from the Democratic Republic of Congo's Uvri province health authorities indicate that the region has recorded 73 cases of the disease within the 7 months of this year in the territories of Reti, Logo, Aru, and Kampala, of which 14 died of the plague. Marked as a disease of public health concern, Dr. Cleophas Ntumpa, the district health officer, Bringi Health South District under Aru territory in Ituri province, noted that at least over 2,000 cases of plague have been registered in the district since 2021, and calls on the collaboration and sharing of ideas with Uganda that he believes will be able to eradicate the country from the plague infection.
Since 2021, in Biringi Health Zone or Health District, we got 321 cases, among which 6 people died. Due to that, we have to strengthen our knowledge in order to respond about this plague.
Whereas Dr. John Opolot, the commissioner in charge of veterinary and public health and zoonosis at Uganda's health ministry, asked both governments of Uganda and DRC to prioritize funding towards elimination of zoonotic diseases.
It is a common practice, so we need to change. People who have the resources, people who have the political will, people who have everything, should really change that attitude to make sure that even if the disease is not there, at least the amount that can be spent on surveillance alone is not as when it occurs, whereby when the disease breaks out, you need to do active surveillance, you put resources. You need to do response, you put resources. You need to do all the other things that are needed, the IPC.
On the other hand, Pascal Oluma, the Health Analyst Division at Ituri Province in the Eastern Democratic Republic of Congo, says the Democratic Republic of Congo has several gaps in the health strengthening systems, including capacity of the health workers, quality of the labs, among others, something that will force the country to rely so much on Uganda's support in strengthening the health system. The Uvri regional lab in Arua currently runs over 100 samples in a row, and this has also been used as a reference laboratory to test and confirm cases of anthrax from South Sudan. But it still remains unclear if this offer by Uganda Virus Research Institute will start soon due to the differences in diplomacies between the countries. Frederick Tamadri, West Nile TV, Nilecast.